So we're going to play what I call the cholecystitis game. And we are going to use that to assess for complications of cholecystitis. Assess for complications of cholecystitis. So we're going to get into it. It's 4 complications, but how are you going to use the various things in the question stem to pick them up? So I'm going to give the preamble, and then I will ask one of the candidates in the class to also read the next line. We are going to use the various things in the question stem to help us to pick up complications of cholecystitis. So my question is this. Mrs. Smith is a 55-year-old woman with a history of obesity and type 2 diabetes. Presents the emergency department with severe right upper quadrant abdominal pain that began suddenly 2 days ago. Continue. She reports that the pain radiates to the right shoulder and is associated with nausea, vomiting, and a fever of 101.5 Fahrenheit. On physical exam, she has a positive Murphy's sign. Laboratory tests reveal elevated white blood cell count and liver function tests. Now, I need somebody, after I've read this preamble, to read the next question because we are going to play the complications game. So please, who wants to volunteer to read the next line for us? The next line.
Match the following complications with the presentations.
Mm-hmm.
So Mrs. Smith has persistent fevers, leukocytosis, and worsening abdominal pain despite the initial treatments.
Mm-hmm.
The ultrasound reveals thickened gallbladder walls with areas of necrosis. What is the most likely diagnosis?
Beautiful. So after we've given the preamble, which looks like a patient with cholecystitis, now we give another line of reasoning. Fever, leukocytosis, worsening abdominal pain despite initial treatment. Ultrasound reveals thickened gallbladder wall with areas of necrosis. What's the most likely diagnosis? Is it gangrene? Is it perforation? Is it emphysematous cholecystitis? Or is it gallstone ileus? This should be very simple. The answer is A. It's straightforward. Gangrene goes with necrosis. So that is the answer. Okay. Now, the same preamble, I give you another patient. After 24 hours of observation, Mrs. Smith develops generalized abdominal tenderness with garden and rebound tenderness. An abdominal CT scan shows free air under the diaphragm and fluid collection in the abdomen. What complication has now occurred? Is it still gangrene or the gangrene has progressed to something different? I see that people are typing B, perforation. Beautiful. So look, the gangrene, you usually pick it up on ultrasound, but then the perforation, look at the way it is presented. Rebound tenderness, garden, abdominal CT shows free air under the diaphragm. That means there's some perforation going on. Okay. Now, the next preamble, after we've read all that, Mrs. Smith has crepitus. As long as you're dealing with cholecystitis and you notice crepitus on palpation of the right upper quadrant, crepitus, an abdominal x-ray reveals gas within the gallbladder wall. What is now your diagnosis? Is it gangrene? Is it perforation? Is it emphysematous cholecystitis or is it gallstone ileus? And the answer is emphysematous cholecystitis. Doctors, are you seeing the way we are building up our points? So gangrene, I'll notice gangrenous features on maybe ultrasound. Perforation, I will see air under the diaphragm. The patient will have signs of peritonitis. Emphysematous cholecystitis, I'll rather be able to palpate crepitus. Now, what's the next preamble I'm going to give? Mrs. Smith experiences severe abdominal distension and vomiting with no bowel movements or gas passing. An abdominal x-ray shows air fluid levels and dilated small bowel. What's your diagnosis now? Is it going to still be gangrene? Is it going to be perforation? Is it going to be emphysematous cholecystitis? Is it going to be gallstone ileus? And the answer is gallstone ileus. So doctors, we have used these 4 questions to help us to know that acute cholecystitis can get complicated. And the complications can be gangrene, perforation, emphysematous cholecystitis, and gallstone ileus. However, each of these complications also has a unique way they will present. Doctors, gallstones, cholecystitis, and everything with it is being made ridiculously simple today. So, I have a question. With all these 4 points we've raised, gangrene, perforation, emphysematous cholecystitis, I want somebody to just summarize it for us. I want somebody to just summarize it for us. Complications of cholecystitis. How will I be able to use various words? Dr. Mundi says, amazing class, various words, various expressions, various things in the thing, in the question stem, to be able to tell me this is the complication, that is the complication, this is the who will want to try? I just want somebody to try. Summarize the 4 points. Don't talk too much. Just summarize the 4 points. What are the high yield things you are learning in the class today? Please, who wants to try?
I can try.
Sure, who is this, please?
This is Idris.
Dr. Idris. Okay, Dr. Idris, let's go.
Yeah, okay. Thank you very much for the opportunity. Yeah, so from what you have taught us so far, that acute cholecystitis can have complications, and the complications are gangrene, perforation, emphysematous cholecystitis, and gallstone ileus.
Beautiful.
All these complications, they are going to present differently. And if there's a gangrene, there are going to be areas of necrosis on the gallbladder. Then for perforation, definitely they're going to be, we're going to see areas of free fluid in the under the diaphragm. That's signs of perforation in the peritoneal cavity. Then for the exophthalmomatous cholecystitis, we're going to see gas on X-ray. Then there will be crepitus, that is crackling sensations on palpation. Then for the gallstone ileus, there's going to be signs of reduced motility, Then, yeah, there are going to be obvious signs of ileus, that is reduced mobility, and signs of obstruction.
Beautiful, beautiful. Yeah. So the matching game, you can take a picture of this. Matching game for complications of cholecystitis. If you see a patient with features of sepsis, and you are thinking about complications, think about gangrene as that complication. If you see a patient with symptoms of cholecystitis, but then it looks like the patient has generalized peritonitis, think about gallbladder perforation. If you see a patient with abdominal crepitus, and the pain is in the right upper quadrant region, think about emphysematous cholecystitis. If you see a patient with bowel obstruction in the context of cholecystitis, think about gallstone ileus. Doctors, it's not just about reading books. It's about understanding the concepts so that when you see a question stem, you can be able to break it down, and then you can be free whenever you are preparing for this exam, because this is a board exam, and board exams come with specific features in a question stem.